Alright, y'all, it's time to discuss male sterilization, aka vasectomies. I'm Artesia, and this is Hannah, and we're team all juice, no seeds. Male sterilization involves the surgical disruption or cutting of the vas deferens. As a result of the vas deferens being cut or blocked, the sperm are unable to be mixed in with ejaculated fluid and therefore cannot carry on fertilizing an egg. In the United States, a vasectomy is the fourth most common form of birth control, aside from condoms, oral contraceptive pills, and tubal ligation. The procedure is performed under local anesthesia in an office or clinic. The procedure is typically performed by urologists, general surgeons, or family medicine physicians. It is recommended to have a consultation visit prior to the procedure to determine the history of excessive bleeding and blood disorders, allergies, sensitivities to anesthetics, and a history of repeat UTIs. The cost of a vasectomy is estimated to be about $1,000. Depending on the procedure, some health insurances may cover some or even all of the costs. Studies have shown that 96% of men will show a severe low level of sperm count or a complete absence of sperm after 12 weeks post-op. This procedure has a 0.15% failure rate with a high rate of effectiveness. This form of contraception reduces the level of sperm count so low that it reliably prevents fertilization.
To ensure its effectiveness, a post-vasectomy semen analysis is routinely performed at the follow-up visit to confirm a successful procedure. Vasectomies are the most convenient and effective method of male contraception due to its simplicity, low invasiveness, and its low incidence of complications. A vasectomy is faster, equally effective, and 1/4 the cost of tubal ligation. Vasectomies do not affect male characteristics such as testosterone levels, libido, sexuality, or sexual function. If the analysis shows over 100,000 sperm per milliliter, a repeat analysis will be done at the 6-month post-op visit. It is important for the patient to use an additional form of birth control post-vasectomy until it has been determined by the doctor that there are no sperm left in the semen. Despite previous assumptions, there is not an increased chance for cardiovascular disease or testicular and prostate cancer. During post-op, it is normal for a patient to experience discomfort for 2 to 3 days along with some pain. These symptoms may be tolerated by using ice, wearing appropriate undergarments, and pharmacological therapy such as NSAIDs and narcotics. Although unlikely, complications may occur. There is a risk for infection, hematomas, sperm granulomas, and chronic post-vasectomy pain syndrome. Don't panic though. It has also been shown that having a non-scapular vasectomy procedure will lower the risk for infections, hematomas, and other complications. The risk of developing a hematoma or infection is about 1 to 2%. Sperm granulomas occur in less than 5% of the population, with fewer being symptomatic. Chronic post-vasectomy pain occurs in about 1% of patients, but it is typically managed with NSAIDs, tricyclic antidepressants, or gabapentin. There are no absolute contraindications on having a vasectomy. The incidence of complications can be influenced by the surgeon and their experience, so it is highly encouraged to get to know the doctor.
Talk to Dr. Joe. Feel free to ask whatever questions or concerns that you might have about your upcoming vasectomy. Now it's time to meet Tim. Tim is the ideal candidate for a vasectomy. He's a 35-year-old male that has been married for 10 years and has 3 kids. Tim is absolutely sure that he does not want to have more kids in the future, and he has discussed this with his wife. Tim is aware of the complications that may arise and the signs and symptoms to look out for to notify the MD. It has been stressed to Tim that a vasectomy is a permanent form of contraception, and that although it can be reversed, there is no guarantee that fertility will be restored. Tim has consented to have a vasectomy and is now speaking with Dr. Joe to gain a more detailed summary of the procedure. Tim has had a successful consultation visit, all of his questions and concerns have been answered, and now he's on to a prosperous procedure.
Now that your procedure is done, remember to take precautions such as avoiding heavy lifting, straining, or engaging in vigorous exercise for 1 week.
We look forward to seeing you for your follow-up visit, and thank you for joining us.